Hello, and welcome to Courageous Doctors, the new show for you and your doctor. On this show today, we're going to cover Obamacare updates, other healthcare news, and health and safety tips. Now let's begin. Reuters talked about the issue of Medicaid, and there's been a lot of talk lately about legislating whether you have to work if you're on Medicaid, or how you're negotiating contracts, trying to get cheaper prices for drugs. So the Oklahoma Medicaid is now negotiating contracts on a prescription drug based on performance of the drug. Let me explain that. This is very complicated, but basically it says that Oklahoma doesn't want to pay a lot to drug companies unless the drug works. Now here's a different spin on that. The Trump administration is giving the Medicare drug plans more choices to lower their drug prices. This will begin in 2020 using a program called indication-based formulary. And basically what that does is the same thing. So they're trying to say maybe Medicaid and the government can save money on the cost of drugs if they look at how the drugs work. Here's the problem with that. The Congressional Quarterly, which gets really into the heart of it, says that going along with this, the government can limit the diseases that the drug can be used for. So do you see how this all comes together? Basically, if you're lucky or unlucky enough to have a disease that the drug, they're going to allow you to use it for, otherwise you're on your own paying for the drug. So I don't know how that helps us. The Hill warns that this is really terrible. Using coupons for diabetes called the copay accumulators. So if you're on an insurance company and you have diabetes and you're trying to pay for all the paraphernalia and insulin and everything, and it can get pretty expensive, and you're using these copay accumulators thinking your insurance company is being nice to you, all of a sudden what you find out is when your accumulators accumulate and are no longer useful, you're stuck with the entire deductible. And you may have been thinking that your deductible was being used up by these accumulators, but it wasn't. It begins when you run out of help from the insurance company. Now everything's out of pocket. So a lot of things are going on trying to lower the cost of price, and we'll have to follow these with you. But I'm not 100% sold yet, and you'll see how you feel, whether any of this is really helping us. Now, Governor Murphy in the Star-Ledger said that we're going to see a 9.3 decrease in our premiums this year. So let's see if he's right about that. Oh, this is something interesting. The Star-Ledger says that Governor Murphy has signed in the earned sick pay leave. It will begin in November. We've mentioned this before. And what that means is you get 1 hour paid sick leave at your regular rate, whether you're part or full-time, for every 30 hours you work. Comes out to about 5 days a year or about 40 hours a year. Now, here's the interesting part. It's for everybody except it may not apply to per diem healthcare workers. I have no idea where that came from. Okay, the Star-Ledger says the FDA is now halting the sale of e-cigarettes to anybody less than 18 years of age. That's been a big problem for a while now. New York Times says that the Department of Justice has finally approved the merger of Cigna and Express Scripts and will shortly approve CVS and Aetna. So you can see that these pharmaceutical and drug-related companies are now getting together with insurance companies. So what's happening is, not pharmacies, but not the pharmaceuticals that make the drugs, but the companies like CVS and Express Scripts that handle the medication and get them out to patients, they're now merging with the insurance companies so that the insurance companies can have a way of saving money. Not that it saves you money, but saves them money. Washington Post says that the Senate has passed a huge opioid bill, and the House also. And, you know, they really want to stop the large sale, especially coming in from overseas, of all these opioid drugs. And fentanyl is a big one they're looking for. And there's a few parts of this bill that's interesting, and I didn't know this. The United States Postal Service, if Trump signs this, The United States Postal Service will be able to screen incoming mail that may have opioids if they're coming from an international address and hold the opioids. Also attached to this bill is funding to the NIH to develop a non-opioid bill, pay for treatments and what have you. NBC mentions, and this is really terrifying, so sit down for this one. The immigrants are now afraid to buy food and use health care. Any government subsidized food, whether you're talking about SNAP, with food stamps, WIC, welfare, any Medicaid or anything, whether it's government subsidized buying extra food or getting health care, because it's called a public charge, and the White House will find a way to throw you out of the country. So we have these people in our country getting sick and starving, and that's wonderful, right? Okay, the White House was, I guess, know what they're doing there. Let's move on to other healthcare news. This is very important. There's been recalls on all the King Bio products. These are homeopathic children's products, everything from decongestants to upset stomachs to whatever. They're all both poisoned, and not all of them, but a lot of them were poisoned and have very bad germs in them, and they've just basically, until you get the okay from your stores, hold off on King Bio. USA Today says that there's been a major ground beef recall contaminated with E. coli, and that's hit 3 states, Florida, California, and Colorado. So if you're vacationing in those states, please check to see about the recall. And Fox News said that there was a recall for salmonella found in the kosher Empire chickens, and just make sure if you're buying kosher chickens that that recall is over. Fox News says, and this is very terrifying, that crabs are still infected with a flesh-eating bacteria called Vibrio fulnificans and parahemolyticus. I reported to you last month that my own personal family all came down with this in Miami at a sushi restaurant eating crabs. And of course, there's been a scare that all crabs coming out of Venezuela are infected with this. But I had a patient recently in the office who was in Colombia, which is, it was either Ecuador or Colombia, which is near Venezuela. And I was very terrified with his symptoms. And of course, I tested his stool and treated him immediately for Vibrio. So just, be aware of this. Newsweek says that people got sick from pig flu in a California fair. We talk about this all the time. When you go to these things, petting zoos, California fairs, all these things, people, please be smart. These don't eat after you put your hand in the animal's mouth. You don't know what they have. Let's see. This is interesting. CBS News, it's not only interesting, it's painful. The Coxsackie we always know is a blistering infection. It's a summer flu. We see it all summer. It gives you mouth blisters, blisters on your hands and feet, vomiting, diarrhea, fever. But we can have it as adults. I think I mentioned to you on a previous show, I had it last year. It was very painful. And my fingers and feet blistered up, and a number of the parents are getting it now. This year, just think back, the New York Yankees, we lost 2 of our starting pitchers for about a month. They had Coxsackie, and they couldn't pitch with blistering. So adults can get this now, and it's very painful, and the blisters take a long time to go away, and so just be aware of that. The New York Daily News mentions that there was Legionnaire's disease in the water at Jacobi Medical Center in the Bronx, and they're trying to clean that up in the filtering system. And recently, we just had an update here in West Orange at our healthcare facilities, not the healthcare facility, at the town hall and some other government buildings. They cleaned all the filters and they're safe now, but Legionnaire's made it into the West Orange town hall system as well. So it's there, and usually we hear about it in New York, but it's definitely there. Newsweek says West Nile hit, and I believe I saw on Channel 12 News last week, I believe it was Channel 12, said that a poor soul in Lodi, a 64-year-old man, died of West Nile virus. So we know these mosquitoes are around here, and it's terrifying. So please, if you're out late with kids at sports events, use protection against the mosquitoes. This is terrifying. West Nile is here, and someone has already died. ABC News says that measles is on the rise. I know they had a big problem in Europe. Fox News, this was scary. 2 cases of somebody, this is very rare, so it's something called capnocytophagia. Phagia means to eat. It was a bacteria in dog saliva that ate away these people's flesh and limbs, and they got amputated. A couple of cases, different states. The authors made it very clear this is very rare, the only 2 cases they've ever heard of. They said, don't be afraid to pet your dogs, that this is nothing to be terrified of. But I don't know where this came from, but certainly we will keep you informed, and keep tuned to your local news if this ever comes up again. This is interesting. This is on a lighter note. Reuters, there was a JAMA article, the Journal of American Medical Association, we often quote and use. The guidelines for screening for women for the pap smears for cervical cancer, it was always until you're 65 years old, from your 30s until you're 65 every 3 years. But now they're saying, since the papilloma virus, the one we give the shot for, the HPV virus, human papilloma virus, to prevent cervical cancer, they're saying that if you want to simply test your blood to see if you have antibodies to HPV, you can do that rather than pap smear every 3 years. So I thought that was interesting. Star Ledger says that, and this is very, very important, on Lyme disease, only 70% of people actually get a rash, and only 40% will have that positive blood test in the early weeks. Generally, the take-home here on this author's research that the Star Ledger was quoting, and I agree with them, is when it comes to Lyme disease or suspicion, just treat it. The treatment is not that bad. 4 to 6 weeks later, do the blood test. If it's normal, they either never had it or they had it and you cured it. It's just not worth it, because if you wait and you're counting on that specific rash, or you're counting on that positive blood test, if you miss it, this thing is long-term in your body and will haunt you the rest of your life with joint and heart disease, can go to your brain. Lyme disease is no fun. I've had a number of people I've known that are my age that it was missed, and it's, so I'm very aggressive with my pediatric patients. If there's even a hint they have Lyme disease, I treat it, and I always do the blood work, but I do that about a month or so later. All right, let's see. This is another thing. National Geographic did a very nice study. They were looking at crayfish. There's been more and more reports of this rat lungworm. It's a type of parasitic worm, and they call it rat lungworm just because the parasite comes from that. And it's also in crayfish. They just want you to be careful for all you sushi lovers and crayfish lovers and all. Just make sure it's cooked really well, because there are parasites from all over the world. I remember reading, we did a news show last year on salmon from, I think, Japan, having one of these, flukes or lungworms or something. So let's see. Fox News reported, I think you probably remember this, we've talked about this, England had its first case of flesh-eating ulcers from a sexually transmitted disease. Here's something. Fox News continues. With the EpiPen shortage, back to school, we've had to write a lot of EpiPens for nut allergies and what have you. And with the shortage, Mylan company was trying to come out with a back order, and the generic was trying to come out. But the company has allowed you to use your EpiPen beyond the 1-year expiration, maybe for a year and a half or so. And the back orders are there. I found that there may be a month delay, but you can get a back order, and you have to fool with the prices. Some of them are more expensive. Depends what your insurance covers. But you will get your EpiPen. You just have to be patient. Star Ledger says, please get your flu shots. Nasal flu shots are available this year. I have them in the office. I have a box of nasal flu, which are live shots. You have to be more than 2 years old and less than 49, so I'm certainly too old for that. And you don't want anybody in your family with an immunosuppressed disease, like if you have anybody that's on steroids or has asthma or cancer or chemo, you don't want to be using a live virus. But for those people that don't want to get a shot, the live virus nasal spray certainly works. It didn't work last year, but it's back this year. New England Journal of Medicine, this was a scary story. Normally tularemia, it's one of the terrorist reported diseases because it's like smallpox, it's a disease and plague that can be a terrorist threat, but it does occur sporadically throughout like the western parts of the country and all. It's rat fever. Rabbit fever. It's where you either ran over a dead rabbit and breathed in, or you ate or touched an infected rabbit. This was this happened in a cat, and the guy's cat died. They thought it had leukemia. It actually had tularemia. I don't know how the cat got the rabbit bacteria, but he had big pussy things on his neck. So it's not that common, but just to let you know, these things are around, just like we occasionally see plague. We reported on it, and there are outbreaks around the world of things, just to let you know, like this crazy one in England with monkeypox. A guy came over from Nigeria. It wasn't smallpox, it was monkeypox, and infected the hospital there. But these things do happen.
Wax Den is a full-body unisex studio. We specialize in hard wax, which is gentler on the skin. We do all types of waxing from head to toe. You can come in with your friends, so you have the moral support. We have hors d'oeuvres. You do have to have a minimum of 8 people for that party, and you would schedule that. Everybody's looking for a hand to hold and then someone to share the experience with, so you can look that up on our website. We have prenatal waxing. We take a little bit more time with the new moms, and a lot of people will schedule that once they hit their second trimester. We do have a waxing membership. It's set up just like a gym membership. It's for Brazilians. It's $45 a month, and you come in just like you would go to the gym. It comes out automatically, and you just show up for your wax. We have several memberships for different services. We also have wax packages. The phone number is 973-542-8442. The website is www.thewaxden.com. We have 24-hour online booking.
Come to the Wax Den. We wax it all.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls, for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
All right, let's move on now to health and safety tips. Just a few important things, and some of these are a little scary. We often talk on this news show about ways we're polluting ourselves, and it's kind of scary. The water we drink, the clothes we wear, the air we breathe, and here's just some more things to be scared of. 2 things, pesticides and weed killers. Washington Post said that the EPA, Environmental Protection Agency, is definitely banning this chloropyrifos pesticide, which damages children. And the CBS says, be careful because a weed killer, so we have pesticides, now we have plant killers, weed killer was found in children's breakfast cereal. Now, how the hell a weed killer got, I'm not even going there. I mean, it's like this. There's lead and arsenic in baby rice. Well, we understand that at least a little because we've reported on this. The land that you're farming, where you're growing the rice, has a certain amount of minerals in it, like arsenic in its baseline. And they're saying just make sure that that land was tested and approved where you're buying the rice, because that baby's rice may have some arsenic or lead in it. Just make sure it was approved. But how do you get weed killer in breakfast cereal? This just boggles my mind. Of course, CNN reporting Michigan tap water. What else has its polyfluoroalkyls? I don't know. I have patients that live in Michigan that visit me. I just hope they don't drink the water. I have family in Michigan. I hope they don't drink the water. Let's see. Oh, here's a positive note, I guess. CBS News, asbestos. Remember, we reported last year on a study where play school crayons had asbestos in them. And now when they sampled it again, the research team found there was only one, I think, crayon or one sample test. Most of the asbestos was removed from the play school crayons. Fox News, I know the summer is over, but for those of you still vacationing, Fox just wanted you to be careful. They did a study on heat illness, heat exhaustion, strokes, headaches, fainting, confusion, seizures, cramps, vomiting. You know, the usual stuff we had all summer. Be careful you get hydrated and all. Now, here's something we reported on before, but I think it's well worth it. It's still going on. People, I don't understand it. This Kiki Challenge, CBS News brings it up. Kiki Challenge, some kind of crazy pop song that people jump out of cars singing and dancing, or they run in front of cars with their bikes, and of course they die or almost die, and I just don't understand it. Some crazy stuff. You may want to look at your monitors for this. The Star Ledger, a pediatrician in UCLA wants to remind us of fluid that you can drink by the proper ages. Even babies after 6 months old should be introduced to water, although I give it before that, but you just don't want it to take the place of their milk. But and then he says by the time they're toddlers and preschoolers, they should be up to 2 to 5 cups. It should be on your screen, and by 5 years old, up to 5 cups, and by teenagers, 8 cups of water. And of course, you know, if you're exercising, take some more. And the Academy of Pediatrics wants to remind us also to decrease juice. No juice to babies, maybe 4 ounces a day to toddlers, 4 to 6 ounces to preschoolers, and maybe a glass, 8 ounces if you're over 7. CBS News reports that the Academy of Pediatrics has once again changed its guidelines. Those rear-facing baby seats, you know, where you can't leave the hospital unless you've tested them and driven around with them. They have all these rules. You can't even leave with your baby until it's done. They now said you're going to stay in those way beyond 2 years until you're at least 4 years old, or till you meet the weight and height guidelines for the seat. And then they have things when you graduate from that seat where you can turn them forward after that. You're still in the back seat. And when you actually go from a booster seat to wearing lap belts, they have guidelines. But basically, so we've moved from 2 to 4 years old, staying rear-facing, or what the weight and height guidelines are for that seat. And then until you're 13, you're in the back. So until you turn 13, you shouldn't even be in the front seat of the car. So those are some updates. Just a couple more things just to totally terrify you on this wonderful summer of poisoning ourselves. NBC News talked about the Florida red tide. I've had a lot of patients that came back sick from Florida, and I was looking for infectious disease and skin poisonings. These people were poisoned in their lungs by breathing this crap in from the red tide, which is unbelievable for all those people that live on the ocean. Let's see, CNN. I don't know if you're familiar with dragon breath. I really wasn't, but apparently people, I guess, on the boardwalk and all will use liquid nitrogen to entice or embellish ice cream and cereals and cocktails. And you kind of like, they put it on, they, I guess, pour the liquid nitrogen on this stuff, and then you blow smoke out of your nose or something. They said that unless liquid nitrogen used in that way can actually get into your body and damage your organs, and liver failure and what have you. And Very scary. And the last thing is that Business Insider just wants to remind us that coconut oil is not great, and the American Heart Association says to avoid it. But once again, I welcome you for joining us again for a wonderful show for Courageous Doctors. We certainly welcome your feedback and look forward to it, and we'll put it on the next show. Until that time, please enjoy the rest of your time. Take care.